How so? You say it changes somebody's life.
Well, let me talk about this one particular girl,
Okay.
Lawana Medley. She came to me. She was very quiet, soft-spoken. She talked to me like this. She didn't want me to hardly see her. She was very embarrassed. She had been without teeth at all. She had no teeth for years. And she had a horrible gagging problem. She had tried to wear teeth in the past, but couldn't wear any teeth.
Couldn't do it.
Just couldn't tolerate any teeth in her mouth. So she came to me for the mini implants, and we made her some new teeth, made her new dentures, and attached them with the mini implants. And now she's going out in public, going out and eating, just tickled to death, smiling all the time.
So they snap in, snap out, or they're fixed?
Snap in. She has dentures that are snapped in place. But the key for her was that she can now wear her teeth because when they're attached with the mini implants, we can cut a lot of that dental plate away. We cut all that plate out of the palate, and that's what gags people so bad and drives them crazy.
Interesting.
So we're able to cut a lot of that plate away so they don't have all that in there. And so she's gone from this, quiet, shy person that would never even go out in public to just going out and enjoying life and smiling big.
So it's a boost in self-esteem.
Having a good time. Yeah.
Okay.
Tremendous.
What about people missing just 3 or 4 teeth? Is that a great candidate?
Yeah, it works just as well, Randy. We do that a lot of times for people. Typically, people may be wearing partial plates. And
what's a partial plate?
Well, a partial plate, people are familiar with that. It replaces several of the teeth, anywhere from one to several of the teeth. It could be front teeth or back teeth. It typically has a metal base, and it kind of has those wire hooks that hooks around the teeth, and those are the things that people don't like because they're kind of unsightly, and they can kind of damage the teeth. So anyway, one of the biggest things we do with these mini implants is replace these partial plates, because what we can do is put the teeth in there to stay. Again, we don't have to cut the other good teeth down or damage the other good teeth, but we can just put the teeth in to stay, really just in 2 visits. We put some implants in.
Now, these people that are missing 4 or 5 teeth, I mean, those things fail. I guess you call them partial plates.
Partial plate.
How long do those last, and how long do dental implants last?
Well, a partial plate can last a long time. Some patients can wear them and do fine with them, but a lot of people don't really like them. They can last a long time.
So a mini implant will last what?
Mini implant, as far as I know, when an implant goes into good solid bone, it's there
forever.
Forever.
What are the frequently asked questions you get? Patient comes in, they're missing teeth, they sit in front of you. What do they want to know about mini implants?
They want to know if they're a candidate. They want to know if this will work for them. They want to know, is it going to hurt?
Yeah.
What it's going to cost? But especially they want to know if they're a candidate, if this will work for them. A lot of people come to me and they've talked to other doctors and been told they're not a candidate. In fact, there was an instance where this one fella, Mr. Louis Eicher, here's his photo right here.
All right.
Okay. He came to me. He couldn't eat, couldn't wear his dentures. He had worn dentures for years and years, and just like we were saying, his gum and his bone had been worn down. He really had nothing left in the lower jaw. And he couldn't keep his denture in. He couldn't eat. He told me that he had seen several dental specialists, and he had been told by all of them that he would never be a candidate for any kind of implants. So he just came to me to see what the mini implants would do, and he didn't have much left down there. But
as far as bone?
As far as bone.
Okay, this is a guy wearing denture.
That's right.
He doesn't like them.
Right.
He goes to you. Everybody's telling him, no, you can't do it.
There was nothing could be done without extensive grafting and surgical processes and stuff like that. And he did not have a lot of bone left down there. But we did his case, and it was successful. He wrote me a letter and said the night of the procedure he ate a salad for the first time in 6 years.
Is that right? Now, why would these other people, why would a dentist say, you're not a candidate, and by the way, the guy looks great? And they don't look like dentures. I mean, this is a good-looking smile, by the way.
Well, Randy, it's just different with the mini dental implants. I mean, traditional surgical implants, you have to have a pretty good amount of bone because they're big. They're pretty good size implants.
All right.
They drill these holes in the bone. You've got to have a pretty good mass of bone for these traditional surgical implants to go in there and to work. With the mini dental implants, we can make them work in situations where there's just not very much bone.
Wow, it
just
seems the
doesn't-
opposite to me, that the smaller the implant, that you would need more bone to hold it.
Well, no, it's
Not
not,
the
that way.
case.
Not the case at all.
So it's the opposite of that.
Not the
almost.
case at all. We can make them work because they're a smaller. Remember, I said they're like long screws, and they're narrower, and the bone can be narrower, and so we have to have some bone, but we can make these things work in situations where there's a lot less bone.
So with this guy, upper lower denture, what'd you do for him?
We made him new upper and lower dentures,
Right.
and then when we had his dentures finished, in one visit we put the implants in the lower.
How many mini
attached
implants?
his lower denture. Typically 4. For a lower denture, typically 4
Is that right?
implants.
4 mini implants.
Right.
And then that what? Just locks it in?
Just snaps in place. It just snaps down on the gum. It just sits there.
Interesting.
So they can eat. It doesn't, it doesn't flop up, doesn't fly out of their mouth. It stays put. So they
So
can
this
eat.
guy, he writes you a letter.
Yeah.
And so salad. So I guess their diet is compromised, you say.
Yeah.
People with dentures.
Yeah. A lot of people, they have trouble eating, and a lot of these people, as they get elderly, I mean, it really, their nutrition really suffers.
What about the person that goes to their dentist and they're told their teeth have to go, and their gums are bad? Can they still get mini implants?
Sure, Randy, and I do that for people all the time also. A lot of times people come to me and their teeth are just horribly decayed, and they're really beyond saving. And typically for a person like that, I'll recommend that we, depending on, well, there's a couple options, but typically for those kind of patients, we'll go ahead and take them to dentures, make them move to dentures and be rid of the rolled teeth, take them to dentures, and then as soon as we get through enough healing, we attach them with the implants, and then they have teeth that can look nice and snap in place and stay in place real secure so they can eat and talk, and they get a real good result from that, and they can look nice again too.
Okay, now you brought some models. We're going to take a quick break. We come back, kind of give us an example of what you can do for the denture wear.
Okay.
You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Up next, more about who's a candidate for dental implant and more about the process of what they can expect when they go in and see you. We'll be right back. You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. We're here with Dr. Stroud. We're discussing mini dental implants. Okay, for the denture wear, what do you do for them? And what's the main benefit for them?
Oh, Randy, for the denture wear, typically their dentures are irritating, uncomfortable, rub, make them sore, loose, can't eat. A lot of times we'll make them new teeth because they need new dentures or they need their teeth to look nicer. So we'll make the new teeth, make them look good, get them fitting good. Then we attach them with the implants, and then they can eat better again. They can kind of eat the foods they want again. And a really biggie that people love is they can be rid of using all that messy adhesive because people just hate that. They just hate that messy
So that's,
adhesive.
I guess, I don't know a whole lot of people with wearing dentures, but I guess that's a big part of their life, having to wear this stuff every day.
With loose dentures, it is. Every day, and more than once a day.
You say people have to increase the amount of stuff they use. Why is that?
Well, as the
adhesive.
as the dentures get looser, you've got to use more adhesive.
Why do they
And,
get looser, though? What's happening?
Well, the bone and the gum is slowly being worn away, so it kind of shrinks down as it's getting worn away, and so the denture typically will get looser and looser. And they're using more adhesive, and they're embarrassed to go out and eat in public.
Is that right?
Their
They
dentures
tell
are
you
coming
that?
loose. Yeah, they tell her that, and they have to get up and go to the bathroom and put new adhesive in to try to keep their teeth tight. So people just love it once this is done, and they can, like I say, they can eat and chew naturally.
I guess a lot of these people, 50 today, 55, is very young. That's, the new 25. So these people that are wearing dentures, what do you say to them? Somebody watching and they're wearing upper and lower dentures, and they're skeptical about mini dental implants. What do you say to them? What's your message?
I would just tell people, I'm just trying to let people know that this option exists, It
Is
works.
it the standard of care now when you're missing teeth that the general dentist says, have you considered mini implants or dental implants?
I don't know, Randy. I'd say, I guess maybe it is, but I think mini dental implants is just still, I guess, a new enough concept that a lot of guys are not aware of it. Even a lot of dentists are not really aware that it works so well